Hey, it's Paul James, and today on the podcast for Ask the Expert, we're speaking with Dr. James Gilsdorf. Dr. Gilsdorf, how are you, my friend?
Just fine.
Good. Well, we're going to chat a little bit today about your practice. You're in the world of orthodontics and my experience and my family's experience with your office to kind of get things started, to talk a little bit with you about how you can help people get the smiles that they want. A lot of moms and dads do what my wife and I did when our kids were a little bit younger, and you see one of those first day of school pictures and you go, you know what? Maybe that smile isn't the smile we want them to have at this point, and we want to help them to be healthier and have the perfect smile when they get a little bit older. And when you notice that, a simple phone call to your office or going to marionortho.com, and they can kind of get started in seeing the possibilities of a beautiful smile for the kids. Talk a little bit about that.
Well, exactly. The first appointment at my office is free, the exam. We take a look in the mouth, talk about what concerns the parents or the patient, and talk about how we can be of help and what we can do to make that smile better. Yes.
Absolutely. And you're seeing those, and maybe you're not seeing what you want to see. My wife and I were in the same situation. Our two boys, now they're in their 20s. We had gone to, the typical dentist appointment you have twice a year, the cleanings, a couple of fillings here and there. And both cases with both the boys, they're like, hey, you might want to think about getting a few things fixed in their mouths. There's some things that need to be fixed with their smiles. And we stopped by to see you, both of which the boys were very young, in the 8 to 12 year range, and sat down. We did that first consultation. We did some impressions, and all of a sudden we've got appliances, expanders, things like that. But I think one of the big keys with my boys were something that you said to us the first time you came in. And that was, I don't know if we're going to need braces down the road. I know that we need to fix or begin on this trail to get some things going. Let's see where it goes. And that was exciting to us because we were new parents, and it's like, oh, so this may just be a fix here or there, or, we might be able to go through a process and get some things fixed pretty quick, or maybe sooner than later. And it all just kind of worked out. I just liked how we had total control of what was going on, and you really made us feel comfortable during the process.
Well, what I try to do is look in the person's mouth, and I look at this as if this were my son or daughter sitting in the chair. It's kind of the golden rule diagnosis. What would I do? A lot of times the roots of the baby teeth aren't dissolving away properly and causing the permanent teeth to go crooked in the bone. And if you leave them that way, they'll come in crooked, actually. And the other problem with your boys, their mouth wasn't wide enough, so we needed the widening appliance to get things to come in better. And what I try to do is help natural growth and development of the teeth, the loss of the baby teeth, and getting the permanent teeth in, to try to minimize the severity of that developing problem. Yeah. So that like you say, down the road, maybe we'll need braces, maybe we won't, but at least we've taken something that maybe is a severe problem and brought it down into the mild or moderate range. And even if we do need braces, treatment would be for a shorter period of time. Maybe then we don't need to take out any permanent teeth, and so on and so forth. So a lot of benefits to the early exam.
Well, it's almost like when you're driving your car and you start to hear a noise, and you immediately think, oh no, what's this going to mean down the road? Do I got to get a new car? No, settle down, go see an expert, and let's start at the beginning. And in their case, popped out a couple of baby teeth, moved a few things around into where they needed to be, and everything kind of went. And the other thing was that I don't know if everybody understood, we didn't at that time, that was quite a few years ago, how much insurance played a wonderful part in us being able to get that done effectively, because you work with all of that every day, and you're just trying to make it work for everybody.
Exactly. And insurance didn't used to be, back in the olden days, didn't used to be insurance, particularly for orthodontics. And then Honda and the city schools and the hospital, all of those people that work at those places, they have excellent insurance. and it helps out a whole bunch in the whole process. Yes.
Absolutely. MarionOrtho.com is a place to go if you're interested in learning more about Dr. Gilsdorf. He's at 325 Mount Vernon Avenue in Marion, and that's where we went.